Every week I meet patients who tell me the same story. Doctor, my hemoglobin is low. And when I ask what they have been doing about it, the answer is usually beetroot juice, spinach, pomegranate, dates, jaggery. Now, before I say anything else, let me be very clear. These are healthy foods. I encourage many of my patients to include them in their diet. But here is the question. Can they cure significant anemia by themselves? The answer may surprise you. Not always. In fact, this misunderstanding is one of the most common reasons I see anemia remain untreated for months. I'm Dr. Ganesh Jaishetwar, Senior Consultant Hematologist and Bone Marrow Transplant Specialist, and today I want to explain what every family should know about anemia. Let's start with an important principle. Anemia is not a diagnosis, anemia is a finding. It simply means your hemoglobin level is lower than it should be. The real question is why? Why is hemoglobin low? Because unless we answer that question, we are only treating numbers, not the patient. Many people assume every anemia is caused by iron deficiency. That is not true. Iron deficiency is certainly common, especially among women, but it is far from the only cause. Vitamin B12 deficiency can cause anemia, folate deficiency can cause anemia, chronic kidney disease can cause anemia, inflammatory disorders can cause anemia. And moreover, bone marrow disorders also can cause anemia. Certain blood cancer can cause anemia. Every hidden internal bleeding can cause anemia. That's why simply drinking beetroot juice without understanding the cause can sometimes delay the correct diagnosis. Now let's talk about food. Can nutrition help? Absolutely. A healthy diet is one of the foundations of good blood health. Iron-rich foods, protein-rich foods, vitamin-rich foods all play an important role. But here is where many people misunderstand the science. Imagine your body's iron stores as a bank account. If your account is slightly low, improving your diet may help rebuild those reserves. But what if the account is completely empty? What if your hemoglobin has fallen significantly? What if your iron stores have been depleted for months, and at that point food alone may not be enough to replenish what has been lost? In some cases, iron supplementation becomes necessary. In other cases, intravenous iron may be recommended, and in severe deficiency, additional treatments may be required. This is why treatment decisions should be based on blood tests, not just assumptions. One of the biggest mistakes I see is when people focus entirely on increasing iron intake while ignoring the reason why iron is low. For example, a woman may have heavy menstrual bleeding. A patient may have bleeding from the gastrointestinal tract. Someone may have poor absorption of nutrients. Another person may have another underlying bone marrow condition. If we don't identify the source of the problem, the anemia simply keeps returning and the patient becomes frustrated. They start saying, "Doctor, I have been drinking beetroot juice for 6 months. Doctor, I have been eating healthy. Doctor, why are my levels still low?" The answer is usually because we haven't addressed the root cause. Now here is the good news. Modern evaluation of anemia is incredibly precise. A complete blood count, iron studies, vitamin levels, kidney function tests, and when necessary, more specialized investigations. These tests help us understand exactly why the hemoglobin is low, and once we understand the cause, treatment becomes much more effective. So what do I want you to remember from today's video? Simple. Healthy food is important, nutrition matters, but anemia is not something that should be self-treated indefinitely. If you have persistent fatigue, shortness of breath, dizziness, paleness, or repeatedly low hemoglobin reports, please don't rely solely on home remedies. Get properly evaluated, because the sooner we identify the reason, the sooner we can correct it. And sometimes that diagnosis can be far more important than anemia itself. Thank you for watching. If you are struggled with anemia, let me know in the comments. And if you found this video useful, share it with someone who believe beetroot alone can solve every anemia problem. I shall see you in the next video. Thank you.